What policy levers are available as we think about strengthening our public health infrastructure in this country?
It's among the things that I am most concerned about right now, based on certain policy decisions that are being made in Washington. Because at the end of the day, the kind of things of a public health nature that are the greatest challenges can only be effectively addressed with appropriate federal investment, whether that's investment in the CDC and the country's ability to monitor the issue of infectious diseases, the infrastructure to, number one, monitor what's happening and knowing what's happening around the world and in the United States is key. And then second is the capability of the response system, which is a very patchwork quilt around the country, largely based on the relative economics of different states. And so in the wealthier states, there is at least the basis of a public health infrastructure to be able to support the interventions when necessary. But there are many states around the country where that does not exist. Therein lies one of the greatest challenges. What's, I think, not appreciated and understood to a great degree is the role of America's hospitals as part of the public health infrastructure. That's certainly true as it relates, especially in the case of children and pediatric care, but it's also very much a function of what options are available across the country. And we need to only look at the response to the COVID pandemic as an example of that. The ability of the American hospital system to be able to adapt to that particular challenge was one of the great moments for the American healthcare system in terms of being able to respond. Since then, the hospital delivery system in the country has been significantly financially weakened and reduced. Payment policies going forward, I think, are going to put us on a path for further reduction.